Hi, I am Annette, the founder of Fat Girls Traveling. Thanks for joining our Q&A this month. And we're actually going to be having a pretty serious conversation. We're going to be talking about family planning and infertility. And those are two things that I don't feel like we discuss enough in fat community. And I have three incredible women joining me today to share their stories. And I'd love for them to introduce themselves. Amanda, can you start?
Hi, I'm Amanda McCullough. I am an American based in the UK, coming up on my third wedding anniversary. And I was self-diagnosed until I talked about it with my doctor with PCOS. Oh my gosh, so long ago now, almost over 8 years ago. And you can find me at arms.wideopen, and where I talk about travel and everything else and more.
Great. Liz, can you tell us where you're coming from and just a little bit about yourself?
Sure. I'm Liz Black. I am a writer, brand consultant, and speaker. And I've been able to fortunately speak at a few different events that Annette has had. I was diagnosed with endometriosis 11 or so years ago. Had to have laparoscopic surgery to actually get that diagnosis since it's such a difficult thing to diagnose, and been trying to get pregnant for well over a year now, and unsure if the endometriosis is preventing things from happening or if it's completely unrelated. Who knows?
Thank you for sharing. And Katrina, can you introduce yourself and tell us what you do?
Yes, I'm Katrina Rollins. I'm based in South Florida. I've been a certified nurse midwife and a nurse practitioner for 7 years. I've treated lots of women with PCOS, but I also self-diagnosed myself with PCOS, just like Amanda said. Actually, when you said that, I chuckled to myself. Many of us have to do that because we're just not getting the testing that we need. So I self-diagnosed myself. I had to go through a DNC because I had endometrial hyperplasia, which is a side effect of PCOS, and I had a polyp as well. So I had to go through that, and then I did Femera to conceive as well. It did take me 3 years. In that process, I also learned I have a uterine abnormality called a unicornuate uterus. So I'm excited to talk about this from a professional standpoint, but also my own personal journey that I went through.
Thank you all so much just for introducing yourself and sharing a little bit about your story. Something that all four of us have in common is that we are fat women. And if you are a fat person trying to get pregnant, you're 1,000% going to have people diagnosing you, telling you that you're going to have issues, or the baby's going to have issues, or you need to lose weight to be in order to conceive. Basically, if you're a fat person, you probably already deal with this kind of judgment from people. But when you're fat and pregnant or trying to conceive and fat, it just feels like more overwhelming. And so that is one of the reasons specifically that we wanted to have this conversation, not only from the social stigma of fatness, but also the medical stigma of fatness. I know I personally have been, I have experienced fat phobia from medical professionals. I don't know if you ladies have experienced that. I know people within our Facebook community have experienced it as well. And so dealing with family planning, pregnancy loss, and then this fat phobia on top of it can be really, really difficult and triggering. And those are the reasons why we wanted to have this conversation. On top of that, I found out it's National Infertility Week. And so I was like, we already had this conversation on the calendar, but it's like, what a perfect time to have this conversation. So it's not the best circumstances, but I definitely feel that like sometimes sharing your struggles can help empower and help educate others. And that is what I'm hoping to be able to do with this conversation. And I want to thank you all for just being open and vulnerable and talking about something that is kind of socially taboo. So it's emotional because we don't have a lot of practice talking about this stuff, you know? So before we get into everything, I would love to just ask the group if you ever had a medical professional or anyone, friend or family, tell you that you weren't going to be able to get pregnant or start a family because of your weight. I know for me, it happened in my early 20s. I wasn't even trying to get pregnant, but a nosy family member asked me, do you ever plan on having a family? And I just casually said, yeah. And they were like, oh, you know, you're going to have to lose weight. You know, you're going to have a high risk pregnancy, you know, and they just started rambling off all these things, which they're obviously not a medical professional and don't know any of those things. They don't know my medical history. And from that moment on, it's been kind of a touchy subject for me because it's always in the back of my mind that people are judging me based on my weight and if I'm going to be a good parent because of that. Have you ladies had to experience that, or has anyone ever mentioned to you that your family planning might be affected by your weight?
Yeah, I actually had a really horrific experience where this was years ago when I wasn't even thinking about having a child and was still very career focused. I was so burnt out from the work I was doing that I went to see a therapist and had talked to the therapist about how I was realizing my previous eating disorder from, decades ago was really amping back up. I was having trouble keeping food down. I had no appetite. I had dropped about 15 pounds in a month because of all of this, because I was so stressed. And after telling her all of it, she looked at me and she said, do you think you're a good weight to be able to have a child? And I was just stunned. Like, it felt like she had slapped me across the face, because not only was I not discussing the idea of having a child with her, I wasn't even thinking about doing that at that point of time in my life at all, like ever in my life, but that I'm telling her, hey, I am seeing an eating disorder reappear. And her response to that is, you're too big to be able to have a child. So, I mean, I didn't go back to see her after that. I left there in tears and I sent her an email telling her why I wasn't going to be continuing to see her. But it was such an absolute shock, because I think at that point in time, no one had ever said something like that to me, because also had made it pretty clear at that point in my 20s, I didn't think I wanted to have children, and I didn't think it was something I would do. So it wasn't a conversation that was often coming up. But yeah, her saying that out of the blue, it was just a reminder of like the fat phobia that's so insidious in so many people, that like didn't matter what I was telling her, that's apparently where her brain was.
Yeah, I think similar with Liz. Growing up in the 90s and early 2000s, I mean, fat phobia, you look at who everyone aspired to look like. So for me recently, it's been more actually, because when I hear about instances like that, I'm like, oh, I never experienced like my family doctor was a really nice guy, but then it's like, actually he prescribed you to be on like protein shakes to help lose weight like for 3 years. And it's just like these instances that just felt so normal at the time, but like upon reflection was not okay. And so it's more actually dealing with the trauma after the fact. And when I got diagnosed with PCOS, I remember it was before I moved to London, and my cousin who was experiencing it, she was like, I really think you might have PCOS. You should talk about it with your GP. And I've been seeing this GP since I was 14 or so. And so I went there and I was like, so I've heard this thing PCOS. Do you think I have it? And he's like, oh yeah, you're definitely a candidate for it. And then that was it. Like, he just didn't even like, think about it. And he's one of the most like well-respected Washington, DC gynecologists. And I had never had any issues. And even in that moment, I was like, okay, cool, there's an answer, but there was no support given. It was kind of just like, yeah, you have it. Diabetes might happen, but you need to lose weight. It's just kind of that enjoy London bye. And I had to really be a self-advocate and read and learn about it. And I think for me, it was just one of those, similar to Liz, I never really thought I would want kids until I kind of met my now husband. So for me, it was always just kind of like, okay, but the answer was always lose weight, lose weight, lose weight. And it was naivety. It wasn't like, I didn't really think about it until like Tess Holiday announced her pregnancy, and like I could visually see people's reactions to her being pregnant and like having a healthy delivery, that I was just like, oh wait, this is a thing, and I really need to like pay more attention to it. Even if I'm not trying to have a kid at that moment, this is clearly an issue.
So actually my experience was when I was already pregnant. So first of all, I went through 3 OB providers. I was very picky in what I was looking for. And I'm the first person to be like, okay, if this provider is not serving you, find somebody else. So finally, on the 3rd OB provider, I found somebody I was happy with. But because of my uterine abnormality, I also had to see a high-risk doctor. So when I met this high-risk doctor, everything was great. She was nice. I loved her personality, but she said to me, we don't want you to gain any weight throughout the whole pregnancy. And I'm just like, how is that possible? I'm growing a whole human being. There's a placenta in there. There's fluid. I mean, that's a lot of stress to put on someone who's newly pregnant. And I already had a lot of anxiety because now I knew I was dealing with this uterine abnormality that I just learned about a few months before. So I'm already stressed thinking my pregnancy is high risk, which it was. So she's just like, we don't want you to gain any weight. She was so convinced I was going to have gestational diabetes, which I did not have, but she was just every, time she was like, oh, I really want you to watch it because you may get gestational diabetes. Looking back, I definitely should have found another MFM, but I think I was so tired from going through so many OB doctors. At that point, I was just like, okay, the MFM is just for consults. I love my OB doctor. So I did continue seeing their office, but it was just a lot of pressure on someone who was already filled with anxiety about their pregnancy to now, okay, you're telling me not to gain any weight at all. And it's just not possible. Of course I gain weight, there's a whole baby in there. And I just don't understand what the evidence is behind telling a woman that, like, in fact, it could lead to unhealthy behaviors during the pregnancy. So that was my experience. I did continue seeing them, but if I do get pregnant again, I think I'm going to start my research a lot sooner now that I know my pregnancy will be high risk. I did not expect to see an MFM. I just always thought I was going to have a normal low risk pregnancy, see a midwife, birth in a birth center. And that ended up not being the case because I ended up finding about this a few months before I actually conceived.
Wow. I want to thank you all for sharing those stories, even though they're all very disappointing, to say the least. And the truth is, not only do we get this fatphobic response from friends and family, we do often get this same fatphobic response from medical professionals. And unfortunately, like you said, Katrina, it's not really based in research. It's just based in the social stigma of having a fat body. But there really is no data that says that if you're a fat mom or a fat pregnant person, that it's going to be more difficult or high risk purely based on your weight. There's no research that says that. So it's really frustrating, and it can be difficult to navigate. I know a lot of fat people in general have anxiety about visiting a doctor because of the fat phobia that we experience when we go into the medical arena. But being a pregnant person and having that anxiety is just kind of not safe for you or the baby. You know what I mean? So there definitely needs to be some headway in this so that fat pregnant people can feel comfortable talking to their doctors about the things that are happening to them without feeling like it's going to be blamed on their weight, and they're going to be told to not gain any weight during their pregnancy or to lose weight during their pregnancy, which, you know what I mean? How is that possible? If you're growing a whole ass human in your body, like you said, it doesn't really make sense, which kind of was the situation for me. I basically was not really diagnosed with HG. I had to self-diagnose myself with it, as you guys did with PCOS. And HG it's basically like hypernausea. It's a form of morning sickness, but it's super severe, and it can result in the mother being dehydrated, losing significant amount of weight, and potentially having, kidney failure and potential death from the complications of the dehydration and the not eating. And that's basically what happened to me. I know, Liz, you talked about being really sick and like losing a lot of weight in a short amount of time. That's what happened to me during my pregnancy. I lost over 30 pounds and was not able to eat anything, was not able to drink anything, was not able to keep anything down. I couldn't go to the bathroom on my own. There literally was nothing that I could do on my own. And it got to the point where my kidney started to shut down and I was unconscious and was rushed to the hospital. And my mom came from the States. I thought that everything was going to be fine with my pregnancy, but because my kidney was in failure, they basically had to terminate the pregnancy. The frustrating part for me, though, or the part that I'm still trying to deal with, is that I wasn't conscious, so I wasn't able to make the decision to terminate the pregnancy. That decision was made for me, and I wasn't told about the decision until a couple days after I was aware of what was going on, because they didn't want me to be too upset about it. And so that is another thing that I want to bring up, is the termination for medical reasons. Sorry, this is going to be emotional for me, but in my situation with HG, like, they say that it was either me or the baby, but the baby was only like 13 weeks old. There's no way that the baby could have survived without me. You know what I mean? And there was no way that I could have survived carrying the baby and moving forward with the pregnancy. And so I know that the decision that was made was the best decision, but I, from this experience, joined a support group that's called Terminated for Medical Reasons. And this is something that so many of us deal with. And there really is no space to talk about it, because with pregnancy loss, there's a lot of conversation about miscarriage or losing pregnancies in other ways. In this situation, the pregnancy had to be terminated for my health. And it doesn't feel like a choice, but it sounds like a choice. It sounds like I was able to make the choice to terminate the baby, but that's not what happened. And so there's not a lot of conversation about termination for medical reasons. When I go to my support group every week, that's something that we all talk about, is just the fact that nobody knows what this is. And a lot of us are uncomfortable sharing what actually happened. A lot of us will say that we had a miscarriage instead of saying that we had to terminate for medical reasons, because we don't want to deal with the questions or the judgment from people thinking that we just got rid of our baby. You know what I mean? In a lot of these circumstances, there's lots of really difficult medical issues that will prevent either the child from surviving or the mother from surviving. And that's why as parents, we're put in this really difficult position to have to terminate certain pregnancies. And so that was one of the reasons why I really wanted to have this conversation, is to just shed light on this other area of child loss that really no one ever talks about. And it was what the result was in my situation. And then something else that I think that a lot of people that struggle with infertility and pregnancy loss deal with is like the guilt. Because when I was in my 20s, and I know this is probably taboo, but when I was in my 20s, I had an abortion. You know, when I was in my 20s, I wasn't ready to be a parent. And now I'm in my mid 30s and I want to be a parent. And now I just lost my baby. And part of me feels like, is that like my repercussion from having that abortion in my 20s? Like, I know that it's not, but like sometimes I get in that mind frame of like, this is my punishment, you know? And I know that a lot of us that struggle with infertility or with child loss will sometimes go into that dark place as well. And so these are just things that I wanted to share, because I feel like we need to normalize these things. These are things that happen to so many of us. Like 1 in 8 couples struggle with infertility, you know, and this is something that so many of us have experienced. And child loss is something that 1 in 6 women experience, you know, and so it's just a conversation that we don't have enough. It's a fucking difficult conversation to have, but I really feel like we need to have it. And so that is my story. That is what I wanted to share. And I would love for Amanda, if you wanted to share a little bit about your story and a little bit more about PCOS.
Yeah, I mean, we all have such different kind of stories. I'm kind of in the planning process of wanting to start the idea of having a child and what that's going to take, you know. With PCOS, it's always been, there's still so much about it, but yet nothing is really known about it. And especially from like a medical standpoint, it's just all very like factual. But when you have conversations with women who have PCOS, it's they've done it all, and sometimes it doesn't work. So it almost feels like it's luck of the draw. And that's a really scary situation to, especially for someone like me, who I write a to-do list of like the most simplest things just so I can check it off, to kind of know that even let's say I was to lose 100 pounds, that doesn't mean actually I will still get pregnant with PCOS, and maybe then the doctor would take things more seriously. It might have something completely unrelated, or pregnancy is just such a delicate yet frank conversation that is happening more, and educating, you know, just like self-advocating to say there's something not quite right with my body. And PCOS explained a lot of those things, but sometimes when you have the answer only gets you so far. And I know for me, especially now, one of the main reasons why my husband and I decided to move to the UK was for the NHS, which is the National Healthcare Services, because I knew that if I had PCOS, IVF was a very high possibility, and being self-employed, insurance, I just didn't think we would be able to afford it. So one of the reasons we moved to the UK was because it can take a while, but theoretically it's much more affordable to try IVF if we can't conceive naturally. But also I say like conceiving naturally with quotes, because is there really like a true like natural way to conceive? I think as long as you're pregnant, it doesn't really matter if it, because who's to say what's natural or what's not natural. And so I'm also navigating a whole new healthcare system, trying to figure out what's available to me, what my rights are as a patient here. And especially coming from the States, it's very much like a customer service based institution, which it shouldn't be. Like Katrina, you're talking about, you know, talking to different doctors to try to find the right one for you. I don't know if I can do that on the NHS. I think you can try, but you're almost at the mercy of whoever is around. And that's a thought that I hadn't even processed before. And I think the biggest thing with PCOS is you have to plan. So even if you're not ready, you have to start trying, because it's almost as if I'm building up my evidence so that when I go to the doctor and I say, I am having trouble getting pregnant, they're not just going to say, okay, well, have you done this? Or have you lost this much weight? Have you gone to do this? And then be 2 to 3 years behind. And so I don't know if for you, I don't emotionally feel quite ready to be a mom yet, but I feel like I have to start that conversation and thinking about it, because I don't want to be 4 years down the line and my doctor is like, okay, there's a 2-year waiting list for you to get to this point, or it's going to take 6 months for you to get your blood work done. And then we're going to need to wait another 6 months after that. So my very first step is I'm completely off birth control for the first time in my life since I was 14 years old. And I have to say, just my hormonal changes, I feel more myself than I have in a long time. And I don't even know. I went on birth control when I was 14. You know, you do it because it's it'll help with acne, but also, you know, to be cool. And you don't really like realize the implications, because I was not sexually active at 14. I was in my books I was, but in real life I wasn't. And I think it's interesting that I'm almost getting rid of the birth control hormones to then start the process of becoming pregnant, and maybe potentially putting different treatments or trying different treatments in my body. This is a really long and drawn out answer, and I really am sorry, but that's just kind of how I feel. Like, it's just a long roundabouts, and I think every week I'm learning something new. And for me, just the first process is I've stopped birth control, and I'm just trying to get my body to kind of be at its level. So, and starting to have those frank conversations with my doctor about starting a family. And it doesn't feel very romantic, but I'm excited about the prospect of having those conversations with my doctor.
I wouldn't say that was drawn out or long at all. I definitely feel like that's part of the process, is kind of figuring out, you know, what you want, how you want to move forward. And like you said, with PCOS, it's more of like a planning process. You know, sometimes it takes 6 months or a year to get the tests and that kind of stuff done. So that's all really helpful. We asked our Facebook community to share any questions that they had about family planning with PCOS or infertility questions. And one of our community members said that they would love to hear how to best prepare themselves to start the fertility process. So kind of where you are now. And then another person asked, they said that they think that they might be being diagnosed with PCOS. So it's probably a similar situation as you and Katrina, where she's looked into some stuff and possibly self-diagnosed herself, but wanting to figure out if there's any helps or suggestions for someone who's just finding out that they might have PCOS and in the future wants to have a family?
Yeah, so for me, kind of Google was my best friend those first few months. And then it was starting to just kind of follow different doctors, fat doctors who kind of talk about it. And that was kind of the first steps. And as far as just like learning and educating, I actually just try to have as many conversations with people who have PCOS, just to kind of see what their experiences are, whether they have kids or they don't have kids, because it's such a, everyone, it's very similar but different. And then as far as like what I physically am like doing to prepare myself with PCOS is I have made it very clear. I work out with a personal trainer, and I've made it very clear, like, I'm doing this to feel strong and to feel good. I'm not doing this to lose weight. I don't want to weigh myself. I don't want to do any of that things, but I want to work out. And it's almost like ammo, so that when I go to my doctor, I can say, listen, I'm doing 4 to 5 workout classes a week. I work out with a personal trainer. It has nothing to do with that. Like, I eat my greens, so don't even come at me with that, which it feels bad that I have to do that, but I was going to be working out anyway, but I just kind of do it. And another tip that I've learned is I'm starting to take prenatal vitamins, even though I'm not trying, because it's just, it's something some people say they feel help them. So it feels really weird to be taking prenatal vitamins, even though I feel like I'm a year or 2 away from that. But again, you have to kind of do research, follow people that you kind of trust. And, at the end of the day with these vitamins, they're all good for me. So it's not as if I'm doing anything too bad to myself. But I think that was my first step. And so far it's working for me. But I have yet to actually like go to my doctor yet and say, this is what I'm doing, because I wanted to be off birth control for 6 months and being, having regular sex, to be like, okay, so just FYI, this is happening. And I think this is going to be, I'm going to need more support. So I'm filling up I'm getting my ammo. And I actually have that appointment in the end of July, which feels like it's going to be here before I know it.
Thank you so much for sharing that, Amanda. Liz, I'd love to hear more about your story and what you're doing with your family planning process.
So much. So we moved to Philly from Jersey City, January 2020, with the idea that we were going to start trying to have a child. And then there was the pandemic and everything shut down. So we decided to put things on hold because we weren't sure what was going on and how it was going to play out, and didn't really want to deal with a pregnancy on top of that. But towards the end of 2020 kind of felt like, fuck it, like life is short and we're running out of time. And so we started towards the tail end of that, took a break for a little bit after my dad died, and then started trying again. And so far, nothing. I, haven't been pregnant once during this entire process. So it's definitely been frustrating with that, in terms of everything that I've had tested has turned out fine. They're aware that I have endometriosis. They did a water test where they inflate your uterus with water to make sure that it looks like it's the right size and shape. That was normal. I did the dye test where they literally inject dye through your cervix up into you so that they can see your fallopian tubes. And that's very uncomfortable. Anything that goes past your cervix is very uncomfortable, but that was even more so, and also just messy. So that was normal. Husband's sperm check was normal. My egg counts were normal. Everything was normal. But here we are, a year and a half of trying and regularly trying. And, I've been using the app Flow, which I do really recommend. I like that app, but nothing has happened. So we have started trying IUI, which is intrauterine insemination. So they have a sample of sperm from John, my husband, and they wash it at the location because they have to wash sperm since it's being injected past my cervix, because otherwise you could actually go into anaphylactic shock. Because it's not going through the cervix since it's being injected with a catheter past it. But so it's a very easy process, relatively easy process, where you just lay there for 10 minutes afterwards and hope for the best. And they have me taking one type of medicine during my period for that, and then I take progesterone once I have the procedure done until I get my period, or hopefully if I am pregnant, then I just keep taking it. But so I just had my second one done. Is that last week? Yes, last week was the second one. And the process itself is really not that bad. I do have to pay completely out of pocket for it. My insurance covers visits with the fertility doctor, some portion of that, but the actual procedures of IUI and IVF are completely out of pocket for us. So the IUI currently is $480. And that's only because I haven't need to use a trigger shot. The trigger shot to help you ovulate can run over $1,000 pretty easily. So that can be the biggest cost that you can incur typically with IUI. IVF, on the other hand, is probably going to run us about 15 grand. That's an estimate. And the clinic that I go to, which is Mainline Fertility in Philly, they have some other locations in Pennsylvania. They offer a program, and I don't know if this is something that's available in other clinics as well. I don't know, but they offer a program where if you prepay for 3 IVF cycles, and if you are not pregnant by the end of it, you get a full refund of your money. But so it's like, do you want to shell out $45,000 potentially that you would then get back if nothing happens, or pay for the things individually, so 15,000 each time potentially? So I've talked with John and our doctor about it, and at this point in time, I don't really want to discuss the details of IVF with them because I want to try IUI, and we're still trying naturally too, but I want to try that. I very much try to focus on one day at a time, and that is something that I can think about in the future. But ultimately, come October, on my 38th birthday, I'll make a decision at that point. That was a decision I made. The doctor was like, you can do IUI as many times as you want, but because they're just helping get it past your cervix, just in case, get it closer to where things are coming out. So I really like my doctor, Dr. Bloom at Mainline Fertility. She has been much more focused just on the health aspects of things. I came in there not wanting to be weighed, not wanting to focus on my weight, telling her, like, listen, I'm going to be a fat mom. I'm going to be a fat pregnant person. There has been an epidemic of pregnant people in the last year that I know, and the majority of them have also been fat. So I have countless examples of other fat people I personally know who have had healthy pregnancies, healthy babies, healthy births. Also, my mother was one of those people. So I have so many examples of it that I refuse to accept that, oh, just because I'm bigger, that it's going to be just automatically high risk. It's as high risk as it's automatically high risk because I am in my late 30s. Like, it's, just kind of like a blanket statement, but kind of meaningless because it's based off of nothing. And my doctor agreed with me. Her concern was just, let's check your blood panels, let's check your cholesterol and your insulin. And some of those numbers weren't so great. And we worked on that. She wanted me to wait on the IUI until I improved those things. But the entire time it was a focus on actual health improvements and not about weight. And I told her, I was like, listen, if I end up losing any weight from it, that's secondary. That's not my focus. And she was fine with that. And I probably likely lost a little weight doing it. Things felt a little looser, but I don't know because I don't weigh myself. But all of those numbers are fantastic now. So, I appreciated the fact that she wanted to try to get me to the best place I could be health-wise, but that her focus was really on those health markers and not looking at me and being like, well, you're fat, so it's not going to work out for you, which is essentially what I experienced at Shady Grove, which was the first fertility clinic that I went to in Philadelphia. They are a huge clinic that has locations, I'm pretty sure, around the country. I think that everything there is very cold and calculated and numbers based, and they don't see you as a human being. So I went through, how to do a virtual appointment first because, again, pandemic. And when I went in, then they had a different person seeing me. I don't particularly enjoy seeing a male doctor when it comes to these kinds of things. I feel like I'm just personally more comfortable around women. And, he wasn't the first doctor that I had spoken with. He was definitely a lot more aggressive about, me being obese and that I was going to have a high risk pregnancy and I would wind up with gestational diabetes, or the baby wouldn't survive or whatever, and telling me that I would need to lose weight and that my, BMI was high. And, even though all these things he was saying was just based on looking at me, because I also refused to be weighed there. So they didn't have any of those numbers to go with. And after doing all of the testing that I had mentioned before, because the testing was done initially with Shady Grove, the doctor then had also, I never met my actual assigned doctor in person. It was only in video calls. So we had a video call with her where she said, after getting all this information that showed everything was fine and normal, that she recommended that I partially amputate a perfectly healthy organ before she would allow me to become a mom, because my BMI was likely above what their limit was for both IUI and IVF. And there is absolutely no reason why you would need to have any kind of weight limit or anything for IUI specifically, because you are 100% conscious the entire time. And it literally, like, they don't give you any anesthesia. It's not that bad of a procedure or anything, but there's no reason that there would be any barrier for something like that that require you to be a specific weight. And then even with IVF, how I don't understand how they could advocate for me being unconscious for, stomach stapling surgery, which is a much more severe surgery, but they won't allow me to be unconscious for egg retrieval or whatever with IVF. So it didn't make any sense to me. And I had to cry about it and felt upset, and then said, okay, I need to find a different clinic because this is clearly not the right place for me. These are not the right doctors for me. They were hyper focused on my BMI. And I think the only reason why I was able to self-advocate both in the moment, like in front of these doctors who were saying that, BMI matters, as well as advocate for myself to be like, I don't need to deal with this shit, I'm going to find a different clinic, is because I've been so involved with, fat positivity and body positivity and all of that for so many years. If I was just, another fat woman who wasn't even familiar that this existed, I'm sure that would have been an absolute devastating moment. I'm sure that they probably have triggered many people's eating disorders based on these conversations. And I always just wonder, when doctors talk about the importance of BMI, like, are they still prescribing cocaine to their patients? Do they think that smoking is a good idea for asthma? Because those were the same types of medical ideas when BMI was created, which also was created by a eugenicist and a mathematician and not a medical professional whatsoever. So I don't have any respect for any medical professional that puts weight in BMI. And I have said that to all the doctors I've interacted with when it comes to all of this. And thankfully, my experience at Mainline has been drastically different than what it was at Shady Grove. And so I very much don't recommend anyone go to Shady Grove at all. And but I think it's just very important, advocating for yourself. And I know that that can be an extremely hard thing to do when you're dealing with something that's quite so emotional. It's even more emotional, I think, than if you're just dealing with your regular, GP. But you need to be dealing with someone that actually sees you as a human being and not just another number that they want to be able to say, this many babies born. That's basically what it is. It's like the McDonald's, like 5 million hamburgers sold or whatever. Like, they want to be able to say that this many babies have been born from their clinic, and they felt, okay, it's going to be too difficult with this person because of them being fat. So let's, we're not going to even help you until you change yourself, because it won't be worth our time. My experience with Mainline has been completely different. There hasn't been any discussion about that. The focus truly was just on health markers. And I appreciate that, because Shady Grove didn't even do that. They didn't even check any of those health markers. They had no information about my cholesterol or my insulin levels. They just were looking at me and saying fat, and so really appreciate the experience I've had with Mainline so far. But yeah, so we're going to definitely keep trying IUI for a while, as well as, you try naturally. Well, you have sex during this kind of time too, because I agree with what Amanda was saying about trying naturally. I mean, like, whether it's medically assisted or we end up doing this on our own without medical assistance, whatever. The point is, we want to try to have a baby. However it ends up happening, I'm in support of. But yeah, we're going to keep trying IUI until my birthday, around that time. And then we're going to have a serious conversation on, do we want to try IVF or do we want to adopt? Because at the very least, even though I know adoption is also expensive and can take a lot of time, in theory, at the end of adoption, you have a baby. IVF, you could do multiple rounds and still nothing. So we'll make that decision at that point. But for now, just really, really hoping that this works and I don't even have to have that conversation, because I really would like to avoid it.
Wow, Liz, thank you so much for sharing that. And I want to say that I'm like feeling a little bit like uplifted that at least you had a positive outcome with the clinic that you're currently working with. Like, unfortunately, like, I'm not surprised that you had a horrible experience at the Shady Lane Hospital. You know what I mean? Like, just because as a fat person, we expect almost to have a negative experience, And Amanda, I know you were going to say something, so I want to let you ask the question as well.
Yeah, I have a question, Liz, because, does Mainline in my, have a weight limit for IVS? Because, that's something, as someone in this space, it's just been so ingrained in me that, like, okay, if you want to do IVF, you have to be this weight, that I didn't even kind of contemplate, actually, I can advocate for myself, or I can try to find a way. So do you know if, like, Mainline, there is no weight limit? And I guess I would just love to kind of know, because that's something for the NHS, and it's something I'm not fully trying to process quite yet. But if I was to do IVS through the public NHS, I would have to be under a weight, and it's almost like a hard limit. And I guess I would just kind of love to know maybe a bit more about that, potentially about maybe it doesn't have to be a hard limit if I advocate or push back a bit more.
Yeah, so I know with the NHS, because of it being like a national health service, that it being government based, I don't know if there's wiggle room with them because of that. But with the clinics that are here in America, because it's not government based and everything, they can all make their own decisions with that. I know with Mainline that there is no weight limit or BMI limit for IUI, which Shady Grove did have a weight limit for that. but yes, they do have a BMI limit with IVF. However, it is significantly higher than what Shady Grove was looking for. I believe, I'm not 100% sure. I think it was either 48 or 50 maybe for BMI. And I'm not positive what that comes out to weight wise. I do know that I had, my size 18, 20, whatever I weigh, I am under what the limit is for their IVF. So I kind of stopped putting thought into it because of that, but it was significantly higher than what Shady Grove was suggesting. So it is possible that, yes, it might come down to the doctor that you find, it might come down to the clinic. But again, if it's a government-based thing, they might not be able to go past that because I don't know, maybe they'll get struck
Yeah.
by the government or something. I'm not sure.
Yeah, I think it's more just because it's like public funding. So it is something ironically, we moved to the UK because we felt we would be more supported in trying to start a family. But unless if I lose that weight, I might have to go private anyway. But I think just hearing kind of you and hearing your story, it's just reminding me actually a lot of language is important, and a lot of these practices feel archaic, and
Yeah.
it takes already a really sensitive kind of conversation, or from an early age we're ingrained that like women, we have babies, like we should be able to have babies, and then it's like actually it's not that easy. And I don't know that many people who have had who have gotten pregnant easily, and we're all different sizes and shapes and ethnicities. And so it's clearly something the messaging needs to be updated. And I think that's how I personally feel, especially with the medical community, is like it just all needs to be updated because listen, BMI is not real. Like we all know this, but we know this because we're in this space, aren't we? If you had asked me 7 years ago, I would have been like, yeah, BMI, the doctors, like I would have believed anything the doctor said to me because I wouldn't even have thought about questioning them. And if you have questions, question your doctor, or at least Google, figure out at least if someone else had the same question as you, because it makes you feel better when you learn that you're not alone.
Absolutely.
Well, we're lucky enough to have Katrina here, who is a medical professional, and we can actually start asking her some of these medical questions. And so just to kick it off with you, Katrina, one of the things that I did on Instagram was I asked our audience if they had ever been told to lose weight before family planning. 85% said that they had been told to lose weight. One of our Instagram followers specifically asked how they can advocate for themselves and enforce boundaries around weight loss with medical professionals. Is there any advice that you can give on that as far as how to create boundaries, especially when family planning, about weight loss with your doctors?
Yeah, so when you go to see your provider, you can always say, listen, I know weight loss is one of the ways to improve fertility. I want to make the most of my appointment though. I already know about that. I'm here to discuss methods and treatments that I don't already know about because the visit time is only so long. So let them know, okay, this is something that I've already tried, or I'm already educated about that, but I want your professional viewpoint on, okay, what other hormonal issues could be going on? I want to check, do I have a fibroid that's in the way? Do I have a polyp that's on my endometrial lining? Because these things can very much affect your ability to get pregnant. Ovulation is one piece of the puzzle, but if you're ovulating regularly and you're still not getting pregnant, it could be that there's something on your lining that's making it impossible for an embryo to implant. So by them just saying lose weight, they're really not looking at the full picture. Ask for those tests. Say, I want hormone testing. Use the word, I'm concerned. I want to make sure I don't have a thyroid issue. I want to check if I have PCOS. I want to make sure my adrenal gland is working perfectly. You can ask for the procedure you were talking about, Liz, that is called the HSG. So that's where they put the dye in. I want to make sure there's no blockage in my tube. That's actually how I ended up finding out, I had the abnormal shaped uterus. So say I'm concerned, I want to make sure there's nothing else going on. And I want to make the most out of my visit by discussing these other options and treatments that are available. And then Liz, you said it already, you can always say, I don't want to be weighed. If, they really want to weigh, or if you're open to it, you can just say, I'm going to turn the other way. So not look where you can see the number. And also ask them to not tell you, but to not put it on the visit summary. So the visit summary is a paper that you get after your visit, and that usually has all the vitals listed, the diagnosis, the treatment plan. So you can just ask them to leave that off, and that's easy. They just uncheck that part from the visit summary. So just really advocate for yourself. I think we grew up thinking that medical providers were gods. Whatever they said, we just kind of had to do. We couldn't speak up for ourselves or suggest anything. But in this day and age, you can definitely do that. I know you said, Amanda, with the NHS, it really isn't like that. But in the private healthcare system that we do have in the US, you can definitely shop around. And like I said earlier, don't be afraid to fire your provider. That's definitely something I've done in the past and I advocate for, because there always is better care out there. You don't just have to think, okay, this is the only answer. There's always a better provider out there who will listen to you.
Thank you. Those are some really great tips. One of the basis questions for this conversation is, does being fat impact your fertility?
Yeah, so there are some biological bases for that. So I'll talk about that, but also it's not the end all be all. What we do know is that fat tissue does secrete estrogen. So we naturally have estrogen in our body. That's critical for us ovulating and for building mature eggs. So you want to have a delicate balance of estrogen and progesterone each month to ovulate. The issue could be the more fat tissue you have, the more excess estrogen that your body produces. So that can lead to something called estrogen dominance. When this happens, all of your other hormones can fall off balance, which can impair that monthly ovulation and decrease egg quality. Now, does that mean every fat person is going to have this issue? No, it doesn't. There's plenty of fat women who do have regular monthly periods and 5 or more kids. I see them all the time. So you have to understand, okay, even though this is a risk and something that can increase, it doesn't mean, okay, this is a guarantee of what's going to happen. And you can always make changes that, like you said, Amanda, not so much focusing on weight loss, but making some of those nutritional changes. So for instance, PCOS, which many fat women have. We know PCOS, one of the components is insulin resistance. And that thrives on those processed white carbohydrates. Try to switch that out with more complex carbohydrates. So just making some of those nutritional changes, doing that, adding a little bit of movement, even if you're not keeping track of the number, or you don't know what the number is, or it's not moving, doing that can make a huge difference in regulating your cycle and regulating those hormones, because now you're not feeding the body those things that are causing the insulin resistance and those metabolic disorders to come up. So there are things you can do to kind of fix that imbalance that's happening. There's also many supplements that can help. So like omega-3, that's a great way to reduce inflammation. So there's different things you can try that's not just, you know, okay, I have to lose weight at any means necessary. You know, a lot of people do that in unhealthy ways. You're still not fixing that hormonal imbalance. Because if you're doing it in an unhealthy way, that's going to throw your hormones off even more. So really the focus needs to be on, okay, what is actually most beneficial for regulating these hormones?
Thank you so much, Katrina. That's really helpful. Something that you mentioned was egg quality. And one of our members asked, when is the time that you should start asking your doctor about infertility testing? Because you were talking about weight might affect egg quality, and basically fertility testing will test the quality of the eggs to figure out if you need any treatments, any fertility treatments. So when should someone, a fat person or any person, feel like they need to ask the doctor about potential infertility treatments?
It does depend on your situation. It's individualized. So if you're having normal, regular monthly periods, they're predictable, you're able to keep track, and you know for sure, okay, I'm ovulating on this day, and you know, okay, this is the time it's happening, I'm having sex at the right time. If that's happening, I always say just try for 3 to 6 months and just see if you fall pregnant. But if it gets to that 6 month mark and you notice it's not happening, then go into your healthcare provider and ask for some additional testing. The reason I say give it 6 months is because for most couples, if there's nothing wrong with either party, and also we always talk about the woman, but we have male infertility too, which is a huge component of it. Um, for most couples where there's nothing wrong with either party, it can take 6 months. That's actually very normal. So I say try for 6 months. And if it's not happening, go in for extra testing. But if your periods are not regular, or you have extreme pelvic pain, or any signs that something could be off, I recommend going to see your healthcare provider as soon as you notice something is off. Because like Amanda said earlier, you don't want to start when you're ready to start conceiving, because now it could end up taking years to identify and fix what the issue is. You want to work on already seeing what works for your body and fixing whatever the imbalance could be, so that when you're ready to conceive, okay, at least I already have my periods regulated, and then I can work on what else is going on. So obviously you won't start fertility meds until you're ready to conceive, but maybe you could start, like I said, doing those nutritional changes, using supplements to see how that regulates your period. So as soon as you know something's wrong, reach out, start trying to fix that, because it really can be a long journey to conceiving, and time really is critical. So just start working on that right away. So when you're ready, you're already past, you know, that first initial point of getting diagnosed, and seeing what works for you.
Thank you so much. That's super helpful. And I want to thank all of you ladies for sharing your story, for joining us. I know for me, one of the main reasons that I wanted to have this conversation is I was starting to think about Mother's Day and like what that means for me as someone who recently lost a baby, and if I'm going to celebrate and how I'm going to celebrate, and just kind of redefining what parenthood and what motherhood is for me. And so I just wanted to bring that, you know, to my community and start that conversation. Also, when I posted about this recently, one of my friends shared about social infertility, which is something I had never heard of. And it's basically when a couple, because of their sexual orientation, cannot conceive. And so that is for like the LGBTQIA community. And so this whole conversation about family planning, fertility, infertility is growing. It's complex, and the language around it is shifting and changing as well. And I definitely think that it's time that as a society, our perception on it and our conversations about it start to reflect the changes that are happening in real life. I'd love to hear if there was any like final thoughts or any takeaways that you ladies had or wanted to leave our audience with before we wrap it up.
Sure. I think what's most important to remember is that doctors are individuals just like the rest of us. They're not infallible. They make mistakes, and that the best thing you can possibly do for yourself and for your future child is to work with a doctor or facility that you feel comfortable with. And if you are not happy with them, make your voice heard. I know that that's extremely difficult to do, but it is worth doing. It's worth speaking up, and it's worth finding a better doctor, because there are doctors out there who are not immediately fat phobic and are more focused on looking at you holistically as an entire person, and not just, oh, you're bigger, and writing you off with that. So the best thing you can do is be your own health advocate, because unfortunately no one's really going to do that for you. So it's just you gotta speak up for yourself. You gotta tell them, no, fuck off, I'll find someone else, you know.
I think kind of following that, start surrounding yourself with a support system, because I think there are going to be days where you feel guilt even though you shouldn't feel guilt, and having frank conversations with your partner about kind of that idea of guilt, because like it is hard, and it makes you feel bad if you might be the reason why you can't do something that both of you want. But I'm very lucky that I have a partner who never makes me feel like that's actually true. It's us together, and having people who you trust to have conversations with, and acknowledging that there are going to be bad days and there are going to be good days, and and be kind to yourself. And I think you should be kind to yourself all the time, but it's so much easier said than done. And so I think your support system is, of course, your doctor, but make sure that you have a safe place to kind of feel the feelings that you're going to feel, not just through the process, but also I think if you are lucky enough to get pregnant, for after that process and during the process too. And so I just find your support system, and I would hope your partner is your first support system, but everyone's relationship dynamics are different. But yeah, I advocate for yourself to yourself as well.
Yeah, definitely give yourself some grace. And this is something also we didn't touch on, but is a huge component. The emotional part of first admitting that there's something wrong. Me personally, that was a huge thing. We kept talking about, oh, I just want it to happen naturally, because that's just what we're shown growing up all the time. And that's how people make it seem, oh, whatever, you just, have sex and you get pregnant. So just that emotional part of coming to terms with the fact that, oh, something's wrong, it's not happening. And then it takes a lot of effort and courage to seek out help, because it's kind of like you don't want to know if something is wrong. You kind of want to pretend everything is fine. So if you are seeking out help, honestly, just give yourself, a round of applause just for doing that, because that takes a lot of effort, especially if you do that and then you do meet a fat phobic provider. I mean, that's just so crushing because it already took so much for you to even make that appointment. So be, gentle with yourself. Give yourself time if you need to take breaks, because it's very hard to keep trying and you just keep getting that negative pregnancy test over and over. Give yourself breaks, and come back to it. You don't just have to be on all the time with trying to get pregnant. That's very important, because stress also does not help with conceiving. So just be gentle with yourself. Like you said, have that support system. And then always, I'm a huge advocate for finding the provider who's going to listen to you, really see your full health history, your full story, and work with you. They shouldn't just be telling you what to do. They should really be working with you in your lifestyle to come up with the best plan.
Thank you all for sharing that. That is all such helpful tips and suggestions. I just want to leave our viewers with the fact that fat bodies are capable of having healthy pregnancies. But if you are unable to have a healthy pregnancy, that does not make you a failure. That does not make you like incapable or any less. And that's why we are working to just redefine what mothering and parenthood means for all of us. And your definition individually can change based on your situation. But medically, fat people are capable of having healthy pregnancies, healthy babies, and we want to continue to spread that message, but also to share our stories and to educate people about infertility, fertility, and family planning while fat. So thank you all for joining us. It has been an emotional and vulnerable but enlightening conversation. Thank you all for joining me today and sharing your story. I really could not have done this without you. You all have reached out to me during this difficult time, and I appreciate you all. And thank you. That is it.
Thank you, Annette. We love you.
Thank you for organizing this, and that